All right, well, welcome everyone, and thank you all so much for attending our very first Alpha Beta Eta member presentation. Laura Deware-Jones is a founding Alpha Beta Eta member and a 2022 MSN F&P graduate from United States University. She started her nursing career in 1993 as a certified nursing assistant and graduated with a bachelor's in nursing in 1999. Since then, she has worked in many different settings, including postpartum, pediatrics, and dialysis. She has also completed 2.5 years of international medical missions in several different locations, such as West Africa and Peru. And now she performs annual health assessments as an advanced practice nurse. Along with a master's and bachelor's degree in nursing, she holds a Master of Divinity and a BA in psychology. Laura is also in the process of becoming a certified provider with the Institute for Functional Medicine. Today, she will share her capstone project on selenium supplementation and sudden infant death syndrome, as well as how she disseminated the evidence demonstrated within her capstone project and how she has shared her findings with other organizations. Please welcome Laura Deware-Jones.
Hello. So nice to see everybody again since graduation. I'm going to go ahead and make myself not so visible to you while I let the screen take the bigger screen. So I wanted to share with you that the projects that we do here at United States University for our homework don't have to just be homework for homework's sake. It can actually be useful for real life. And so that's what I want to do today is share this with you. So I did my capstone on selenium supplementation and sudden infant death syndrome. And this is actually getting ready to now be presented to the Kansas nurse practitioners for their upcoming conference for a CEU. So I've modified my capstone PowerPoint just a teensy bit for them. So I'll let you kind of sneak peek in on how it's progressing along. Actually, it's already been turned in, so the disclosure's there. Let me move my little screen so I can see you. And the learning objectives that you'll get to see as well as we go along, and I left them some little stars to find their answers. So, sorry. So this is my poster. I don't know if is my black line in the middle of your screen? I don't know how you see it.
Nope, it's nice and clear. You're good.
It's nice and clear. Okay, great. Okay, so this is my poster, and you can see all the different areas. And as you might know, a poster, although it does look kind of crowded, it really is just an overview, a visual picture of the things we're going to discuss next. So these are the types of things we're going to be discussing next in our presentation. So an overview of the problem is SIDS is a public health priority. Just realized I needed my notes here on the other page. And so it's about 4,000 infants that die every year in the United States without immediate known causes. And with our population, that's about 4,000 infants. And it remains the leading cause of postnatal death between 1 month and 1 year of age. Typically, as you might have noticed, the approach has been on safe sleep. However, it's been noted that the Back to Sleep teaching program, even with that for 25 years, the rates are unacceptably high. And I think that's something that needs to be addressed. If all this education of back to sleep is still ineffective, is there anything else that we can do to promote health prevention, promote health and disease, prevent disease with our most vulnerable population, the little kiddos that depend upon adults for their safety? Let me see if I have to change the page here. So you can see here the 2020 Healthy People maternal goals is to decrease the infant deaths from sudden infant death syndrome. And in 2023, it just changed slightly to say reduce the rate of infant death. So it's a little more vague in the 2030 ones. You might have noticed the increase of devices around for children. There's about 47,000 now, but they've only increased ER visits, not decreased SIDS. And so if education on safe sleep has been consistent but not effective, perhaps the problem is not just sleep positioning. I have noticed with the research that there has been for the last 50 years links between selenium deficiency and SIDS, and it's been in one source said it was proven to be the basis for sudden infant death. Another source talked about how when you're pregnant, if you have a selenium deficiency, it can have a wide variety of problems, including SIDS. And after birth, if the deficiency continues, then it can result in crib death or SIDS. In fact, even during nursing school, there was new research that came out about a neurotransmitter, butyrylcholinesterase, that was found in those with SIDS. Interestingly, 2 years before that, it was already shown that decreased selenium causes the elevated levels of that enzyme. I think it is past time to implement research into clinical practice. So here is a brief overview of the review of literature. One of the resources really wanted to see, because I hadn't actually implemented my research yet, they really wanted to see more of a review of literature. So here is more of a list. I'm not going to read that all because that would be intimidating and it's really full. But some of the clues in there for the CEUs of information that they need, I kind of highlighted theirs. So in 1817 is when selenium was discovered in Sweden. And by 1931, it was noted that there can be toxic levels of selenium. In 57, it was noted to prevent disease. And in 1970 is when we have the first research showing the link between selenium and SIDS, which of course was too old to quote for all of my research for school, but it does show the beginning of how long it's been in research. In fact, in 2009, you can see that the greatest risk for SIDS is at 6 to 20 weeks of age when the antioxidant protection is low, when you've got increased vitamin C and iron creating oxidative stress. I am familiar with a person who helped confront the FDA about increasing the selenium in infant formula. And in 2013, the FDA did increase that. And what's interesting is in 2014, the SIDS rates dropped on the charts. But I don't know if anybody else has noticed the link between the two of them. And I don't think that we should just encourage people to have infant formula because, as you all know, mother's milk helps develop immunity and protection from all sorts of things, and one of which is SIDS. And so the challenge comes, though, that selenium in the breast milk is dependent upon the mother's intake. So part of the favorite thing of school is to also include not just what we're doing, but why we do things. And that is why I have included the theoretical model or framework for this research and plan that I think is helpful. And I decided that Linninger's cultural care theory would be really appropriate for a couple of reasons. Linninger works to create a way for nurses to give culturally congruent care. And I thought, seeing how it's not just sleep positioning, and we have families that are resistant to back to sleep programs, whether they think the baby's going to choke or just following their parents or it, a variety of things that were found. And so I just think including culture is going to be important on this topic. Also, the research that I'm thinking needs to be done is going to involve two kinds of research. First, the quantitative, which is, the details of steps of the results in terms of the selenium levels that people will have and the results of decreased SIDS and other diseases caused by selenium deficiency. And I think the qualitative research part will be able to fit with going over parental fears. And if they can say, hey, look, I can choose my selenium intake and I can affect my baby's health, and giving them more control, if that will help take away the edge of the fear of, I don't know, how do I know if my baby's going to have SIDS? And maybe that will help with the fear factor. And that might be a way to address both kinds of research. On the right side, you'll see a theory logic model that I created with the arrows. There are, I think, a variety of factors of things that contribute to SIDS. Obviously, everybody else is focused on the sleeping position, but I think that's really a small factor as evidenced by the smaller arrow. I think the major issue is really a selenium deficiency. And there are some examples in that larger arrow that show different ways that you can get selenium deficiency. So some interventions that I think here would be Our PICO statement that in children from conception to 1 year, what is the effect of intentional selenium supplementation in comparison to those that are unintentional, just whatever happens, they happen to eat on SIDS. And that would be addressing the hyposelenosis or selenium deficiency. I think the way we can do that is to give a selenium brochure to the intervention groups with pictures and lists of food. And you can see some of them there in the picture. Brazil nuts and seafoods organ meats are the highest, richest sources of selenium. Other sources are muscle meats, cereals, grains, and dairy products. Infants at the highest risk of SIDS are born to teens from American Indians, Alaskans, and African American ethnic groups. And so these groups are often in their lower economic status and use the WIC a lot. And so I think it'd be important to contact WIC because Brazil nuts are not on the WIC list, and that's a really easy way to get your selenium levels up really quickly. So I think it'd be wise to get temporary permission from WIC to have high selenium foods approved during the time of the study. And we can even advocate for WIC to add Brazil nuts to their list. Part of what's interesting about selenium is how it's found, and it's in the soil. So I'm in Kansas, and as you can see in Kansas, there's a wide variety of selenium levels, even in my state alone. And it's not only like this in the US, it's like this all over the world. There's different areas where it's really high and areas where it's really low. And so it's important to be aware of the selenium levels. And this affects the soil selenium affects the food because what's in the ground is what's the plants pull out of what's in the soil. And the animals eat the plants that's in the soil, and we eat both the plants and the animals from local and far away. And so it's important to know if you're getting enough or hopefully not getting too much, depending upon where you live. There is a toxicity. And that was noted first in cows, which of course are eating the plants. So, and then what's unique about chickens is that their meat has a limit of what their muscles can hold of selenium, and so you won't get toxic levels of selenium from your chicken if the chicken has been fed selenium. Otherwise, you won't get enough selenium from the chicken. Therefore, you can see with all these variable factors, lab work will be necessary to confirm the individuals have a good selenium status. And these kind of labs of frequency are going to be on our next slide. So erythrolyte selenium, well, let me say it this way. Selenium can be measured in breast milk, hair analysis, urine, and blood. But for culture and laboratories and clinic flow, I think it'd be best to use urine and blood. Erythrolyte selenium shows the last few months of selenium intake, kind of like an A1C does. And we could measure mom's serum selenium when she's at preconception appointments or initial OB visits, just like when you draw blood for other things at the same time. At delivery, you may or may not want to or need the blood level, but it's easy to get it from a cord blood if needed at that time. Urine is a cost-effective way to measure current selenium levels. And measuring mom's urine during her regular monthly OB visits would fit in with the current flow. And then the only thing that would be slightly different would be getting the first year's child's well checks. If she's exclusively breastfeeding, then we can just measure mom's urine. But when the baby switches to no longer exclusively breastfeeding, then we'd want to make sure that we're checking the baby's urine, which would be the slightly different part from the clinic flow. Also, as part of the methods and design, we can be getting parental surveys for how they're feeling about the approach that we're doing to help with addressing SIDS. Some main points for family education is a simplified version of what I've really shown you, but it'd be a lot simpler for them. And that would be that selenium concentrations in the soil vary, and that affects the plants, animals, and human intake, and subsequently their own mineral status. These differences in selenium concentration affect the children's health, such as SIDS. And mother's milk and preterm has helped preterm and term infants to develop immunity and protection from SIDS. Some of the nutrients in their breast milk, like selenium, depends upon their nutrition. That's why maternal supplementation is going to be important to address the variety observed in their milk. And we can also let them know about the FDA decision to increase infant formula selenium so they're comfortable there if they're not able to breastfeed. And to let them know that there's a toxic level if so that's why it's going to be important to have a balance and check their labs to make sure that they're in a good point, not too low and not too high. And although food sources on the list, I help them to realize that the food sources on the list might be approximate because we don't know where they're getting their food from. And to let them know that Brazil nuts are the highest. Sometimes even just one Brazil nut would be sufficient for the day. We can let them know about the chickens and how their muscles do well to prevent toxicity, and let them know that we'll need the labs. Next, here we have the expected results from our work. On the quantitative data, you can see on the chart there, it's anticipated that the people that participated from preconception, they would have the lowest amount of SIDS at risk in the yellow, whereas those that had intentional selenium intake after they were already born, they might have more risk slightly, whereas those that who knows what their selenium intake is, they would remain at the highest risk of SIDS. And these would all be combined, of course, in a t-test result, which is a nice way to show at the table for this type of material. For the qualitative research, it'll be helpful to use the surveys and see how the parents are feeling and put all that through a computer that will be able to spit out how their answers are coming along. Anticipated conclusions is somewhat similar here. And oh, sorry, it looks like I did too many. Oh, no, I did the right one. Sorry, my screen on the other page on the wrong one. All right, so anticipated conclusions is that people will have appropriate selenium levels. We would have decreased SIDS rate. We would have decreased grief from infant death, decreased parental anxiety about SIDS, more living children participating in society, and obviously increased more happy families. And hopefully that'll help with decreasing anxiety and risk for parents that they can participate with the without using sleep positioning compliance, especially those that have resisted the back to sleep program. Now, I think the potential for practice implications is really important. And that's why we do all this research, not just to be boring and create research, but to change life. And so I think it'd be really good for there to be things like the meta-analysis. I mean, there's already been 50 years of research. Can somebody start to put that together and make it more user-friendly? Because guidelines don't usually change without some meta-analysis. And so let's try to get meta-analysis going with the research that's already been done. And I think the bottom line is we need to be changing guidelines for prenatal care as well as SIDS. I would like selenium to become the next folate where both providers and public will want to make sure that they're not deficient or toxic to meeting their health needs of the next generation. I think WIC could permanently add Brazil nuts to their list. Perhaps selenium could be added to nutrition facts on food labels along with other nutrition items. What would happen if the United States government agricultural modified my plate to include selenium-rich foods? That way kids would be growing up knowing their selenium intake, because teen moms really need to have sufficient selenium levels from before conception. Prenatal vitamins could include selenium. That would be helpful. Less than half that I found even had selenium in them. And parents overall might be relieved that they can use this with or without the sleep positioning compliance. And we might even see other health issues with selenium deficiency decreased, such as infertility, miscarriage, low birth weight, infant mortality, slow growth, small size, anemia, hypothyroid, postpartum thyroid disease, autoimmune disease, chronic fatigue, muscular weakness, muscular dystrophy, muscular sclerosis, Malaysia, muscle tenderness, fibromyalgia, cystic fibrosis. I mean, there's so much. Neuromuscular diseases, hypertrophic cardiomyopathy, liver cirrhosis, lupus, Parkinson's, dementia, decreased immune function, and cancer. In fact, they've even, Dr. Wallach was able to help the FDA to say that you can use selenium to reverse breast cancer. So there's a lot of things that selenium might help other things as well. All right, so hopefully you and those coming to the Kansas meeting will see the learning objectives have been met here, that there are sources of selenium for adults, such as foods that they can eat, listed there that we've reviewed, as well as the infants. They could get it from the infant formula now in the US. I don't know about other international sources of infant formula. And then breast milk if the mom's taking appropriate levels. And as you now know, selenium is affected by the soil level, how much is in the soil. And we can measure it easily, I think, with a list of the erythrocyte, selenium, and then the urine. And these are my pages of references. There's 4 pages. I don't think you want to read them for very long. I do have a cute little thank you. And so I thank you for letting me share my presentation. I was able to share this with the Institute for Functional Medicine's annual international conference in Orlando this last summer. And I met a provider up in the Northwest, and they said that they already are sharing this, already doing this at their clinic in that area. And it was interesting to see that somebody else was already doing it, I thought. So I would like to change the world, and maybe you can help with me to change the world. And let's see if I can figure out how to stop this. I'll show you what other places where I've tried to share my research. It's really cool. Let's see, let's exit the slideshow. For the Association of Missouri Nurse Practitioners, they just wanted a really simple slot poster where you can just see the poster itself without any real fluff. And they told me they wanted it in grayscale. So I was able to do a variation of my poster for the Missouri Nurse Practitioners, and it is loading. It was ready, but you know, electronics.
While we're waiting, I just wanted to say that's such an interesting topic, and it's really impressive to see your passion and your expertise on this topic. And also just wanted to make sure that we open it up to the audience to see if anyone has any questions for you.
Oh yes, I'm almost done. Yes, yes. So I just
yeah.
wanted to show you. So they didn't want me to post any like anticipated answers. They wanted to see real significance and review of literatures more. So different places want different types of things. So as you go about trying to share your research on your topics, it just might need to be tweaked depending upon what the different people want. And what was really cool, I thought, and I wanted to show you this, was when I did it with the annual international conference in Orlando, they had us put our research into a program, and it was like interactive. And so I'll just show it to you briefly, and then I'll start answering questions. But so this is what my poster looked like on the at the site. There was on a huge TV, like way really big TV, and then you could touch it, and it would like play your recording of what you had recorded. So it was sort of like a combination of a PowerPoint and a poster all in one. It was really cool, and even had a spot where you could put in a video. And I decided to go ahead and use that outfit for the picture. Is what I chose to wear when I was doing my real presentation. So I just thought that was really cool, in different ways and styles of how different companies want to see different presentations. So now I am done with what I wanted to say, and I would really love to interact. And let me figure out how to get out of this spot.
Okay. This is Dr. Blessing Siguzo. Great work. I just had a quick question. Can you hear me?
Yes, I'm trying to get to where I can see myself again instead of just the screen.
Okay.
I don't know where I went to. Well, I don't know where I am, but hello.
Yeah, we can see you.
Okay, you can see me. Okay.
Yes. So I just out of curiosity, who was your instructor for your capstone?
Oh, that's on my poster. Let's see. On my poster, I think it was began with an F. Sorry, Falsetta, I think it was. It was on
Okay,
my
great.
poster.
Excellent.
I had a thank you to her in my right there. It says, my appreciation to Dr. Falsetta and many cohort classmates.
Yeah, that's awesome. Now, the last question I had was, uh, are there any reference values for the selenium when the labs are drawn? Is it like good, bad, or numerical value like 3 to 5 or something like that?
That's a really good question. I would think there ought to be, but I did not collect that data yet. But that would be a good idea. I should write that down, a list of things to write down. I just
Thank you.
the things that I talked about that I read when I was preparing my documents just talked about that it was needed and it needed to be in a certain range, but they didn't. If they did, I don't remember it right now. So I will make a note to write down that range.
Excellent work. Excellent work. Congratulations. Thank you for sharing.
You did a great job. I just have a question. I'm really familiar with selenium in support of people with hypothyroid, and I'm wondering, when you did your literature review, did you come across a link? Is there any kind of, besides the known hypothyroid selenium, is there a link with SIDS and hypothyroid? Is that possibly selenium is correcting hypothyroid in the women, which is possibly contributing to SIDS, or is there not really a link between the hypothyroid and SIDS?
One of the research articles I read talked about the postpartum hypothyroid being a really getting worse with those that were not getting selenium during their pregnancy, and that put them at higher risk as their own selenium levels went down. And the thought, yes, thyroid is the organ that uses the most selenium, and so usually people do focus on thyroid and selenium. I didn't notice anybody saying that people that had low thyroid had more SIDS, although that would be a curious factor, but I don't know if anybody has put those together enough to check that out.
Yeah, I was just curious. We do know that women who have severe hypothyroidism that is untreated in pregnancy, it can affect the infant negatively. They can actually have decreased learning, disabilities, and that's a problem. But I didn't, like I said, I didn't know if there was a link with SIDS, but it's just really interesting. And it is pretty common knowledge with hypothyroid, and people are giving that. I mean, in primary care, we're giving that for people who are like subclinical. We're kind of doing the selenium, trying to avoid starting Synthroid. And so I hope that this becomes as prevalent as selenium with hypothyroid, where more people know about it. So thank you for sharing.
Yes, and also what I've been starting to learn with the Institute for Functional Medicine about thyroid is there's all sorts of different mineral deficiencies as well as infections and inflammations that affect thyroid status. And really we should be using the I'm trying to remember the right word. The endocrine system, I can't remember what it's called, but the College of Endocrine or whatever, that group's reference ranges for TSH instead of the broad ones of the 0.5 to 5 is way too broad. It needs to be closer to like 3. And so that will help, I think, with finding people that are having thyroid issues a lot sooner.
All right. Does anyone else have any questions? All right. Well, that concludes our presentation. Thank you